Ever wonder if ancient secrets hold the key to modern wellness? What if I told you there are roots, revered for centuries, that could literally reignite your internal river? Welcome, curious minds. Today, we're unlocking the profound wisdom of traditional Chinese herbalism, exploring three incredible botanicals that are powerhouses for healthy circulation, healing, and vitality. If you're ready to dive into the fascinating world where ancient knowledge meets cutting-edge science, make sure to hit that subscribe button and ring the notification bell. You won't want to miss what else we uncover. First up, a legend known as Nota Ginseng or San Kai. Imagine a root so potent, it's been called the miracle root for blood in ancient texts. Originating from the misty Guangxi and Yunnan provinces of China, Nota Ginseng has been cherished for centuries, often used much like a precious jewel. Traditionally, its primary strengths are truly remarkable. It helps eliminate what's known as blood stasis. Think of it like clearing energetic blockages, reducing swelling and inflammation, effectively soothing pain, and perhaps most impressively, stopping bleeding. Yes, whether it was internal concerns like coughing or vomiting blood, or external injuries, San Kai was the go-to. Modern usage often sees it treating injuries and soft tissue damage, and it's a highly effective natural agent for stopping both internal and external bleeding. What's even more exciting, it's also seen success in supporting heart health, particularly for conditions like coronary heart disease and angina. Now, let's peek behind the curtain of modern research. Scientists have found Nota Ginseng packed with powerful compounds called saponins and ginsenosides, similar to the famous ginseng. Pharmacological studies reveal its ability to significantly decrease blood coagulation time and act as a satisfactory hemostatic. It actually shortens bleeding time and can increase blood platelet count. Beyond that, research shows it dilates blood vessels, boosting coronary circulation and even lowering systemic blood pressure. It's also been noted for anti-inflammatory, anabolic, and androgenic properties, boosting protein synthesis. And as if that wasn't enough, it can help reduce blood lipids and cholesterol levels, even showing anti-aging potential. Clinical studies have indeed affirmed its effectiveness for angina, arrhythmia, and myocardial ischemia, even matching conventional treatments in lowering cholesterol. This isn't just ancient lore, it's science in action. Nota Ginseng dosage, precautions, side effects. So, how is this powerful root typically used? Orally, it's often taken as a powder, anywhere from 1 to 3 grams, or as a decoction, 3 to 9 grams. The powder can also be applied externally. A vital note here, as with any potent natural remedy, always, and I mean always, consult with a qualified healthcare professional before incorporating any new herb into your regimen, especially if you have existing health conditions or are on other medications. With that said, traditional wisdom advises caution for pregnant women and those with symptoms of anemia. For external application, stick to the suggested dosage. Under normal conditions, Nota Ginseng is considered safe at recommended oral doses. However, a small number of people might experience mild, temporary side effects like dry mouth, a slight increase in skin temperature, nervousness, or insomnia. Very rarely, nausea and vomiting have been reported, but these usually fade once the herb is discontinued. Toxicological studies in animals have shown it has a very high safety margin at typical therapeutic levels. Salvia root, danshen, the heart and blood mover. Next, let's talk about salvia root, famously known as danshen, the red sage root. This beautiful botanical, with its deep red exterior and purplish interior, is cultivated across China and has been heralded for centuries as a master of blood circulation. Traditionally, danshen is celebrated for invigorating blood flow and powerfully resolving blood stasis, making it a true blood mover. It's been a cornerstone in addressing everything from abdominal pain caused by stagnant blood to a wide range of gynecological and menstrual challenges. For centuries, it's been a trusted ally in treating traumatic injuries, inflammation, and pain. But perhaps its most compelling traditional use today is its profound impact on cardiovascular conditions like angina, and its role in helping prevent heart attacks. It's also been recognized for supporting liver health and improving impaired peripheral circulation. Some even hail it as a powerful anti-aging herb, emphasizing its restorative qualities. It's also traditionally used to nourish the blood and calm the mind, proving useful for insomnia and restlessness. Modern science has indeed placed danshen under the microscope, confirming many of these ancient claims. Researchers have identified key compounds, especially a group called tanchinones, with tanchinon IIA being a major active ingredient. Pharmacological studies have shown its incredible ability to invigorate coronary blood circulation, significantly increase blood flow, and improve overall cardiac function and myocardial contraction. It enhances microcirculation throughout the body, boosts tolerance to low oxygen conditions, and crucially, inhibits blood coagulation while activating fibrinolysis, essentially helping to prevent and dissolve clots. Beyond its circulatory benefits, it exhibits sedative and tranquilizer effects on the nervous system, helps lower blood cholesterol and sugar levels, and even shows antimicrobial action against various bacteria. And the clinical findings are truly impressive. A large study in China with hundreds of angina patients showed marked relief in over 80% of cases, with significant improvement in ECG readings. Salvia injections have even been used in China for acute heart attacks, reportedly reducing mortality rates. It has been shown to be superior to nitroglycerin in some studies for ischemic heart disease, offering more persistent effects and improved cardiac function. It has also demonstrated positive results in lowering blood pressure, aiding recovery from stroke, and supporting chronic and acute hepatitis. Salvia root dosage, precautions, side effects. Typically, salvia root is taken in a decoction with a dosage of 6 to 15 grams. Stir-baking it with wine is said to enhance its potency for promoting blood circulation. Once again, this information is purely for educational purposes. Always consult a qualified medical professional before using any herbal remedies. Important precautions for salvia root include avoiding its use if you have bleeding problems, are pregnant, or are taking anticoagulant or antiplatelet medications due to its blood-thinning properties. It's also traditionally noted as being incompatible with black hellebore rhizome or veratrum root. While generally safe at therapeutic doses, some individuals might experience dry mouth, dizziness, fatigue, hand numbness, shortness of breath, chest tightness, mild irritability, rapid heartbeat, nausea, vomiting, or general gastrointestinal upset. These symptoms are usually mild and tend to disappear once the herb is discontinued. Toxicological studies have supported its safety profile at typical administration levels. Herb 3. Carthamus honghua, the vibrant flow revitalizer. Finally, for this segment, let's explore Carthamus or honghua, also known as safflower. This vibrant, fiery red flower, picked in the summer and dried, was actually brought to China from Arabia centuries ago and has a fascinating history as a dye, a culinary ingredient, and most powerfully as a medicine for blood disorders. Traditionally, Carthamus is a strong invigorator of blood circulation, excelling at eliminating blood stagnation and alleviating pain. It's been widely used for chest pain, abdominal discomfort, and menstrual pains caused by stagnant blood. For those seeking support for coronary heart disease, it's often combined with other circulatory powerhouses. It's also a traditional ally for soft tissue injuries and traumatic pain. But perhaps one of its most common and appreciated traditional uses is in normalizing menstruation, helping to stimulate menstrual flow and address issues like amenorrhea, absence of menstruation, and painful periods. Modern research illuminates the science behind these ancient uses. Safflower extract has been shown to have significant biological actions on the circulatory system. It actively dilates coronary arteries, increasing vital blood flow to the heart. It can lower blood pressure in studies by dilating blood vessels and even subtly stimulate the heart. Importantly, it inhibits platelet aggregation, helping to prevent blood clots, and even increases the activity of plasmin, an enzyme that dissolves clots. Beyond blood, it demonstrates sedative and tranquilizer effects on the nervous system. Research has also observed a tonic or contractile action on the uterus, which becomes more pronounced in a pregnant uterus. It has also shown antimicrobial activity against certain bacteria and has been found to lower serum cholesterol levels in rabbits. Interestingly, components of carthamus, like safflower yellow, show both immunosuppressive and strong anticoagulant properties, while other polysaccharides from the plant are immunopotentiating. What a complex and fascinating plant. Carthamus dosage, precautions, side effects. Typically, carthamus is used in a decoction, with a dosage ranging from 3 to 9 grams. As a reminder, this content is for informational purposes only. Do not attempt to self-diagnose or self-treat. Always consult with a qualified healthcare provider for any health concerns or before starting any new treatment. Carthamus is generally considered safe at therapeutic doses, with no severe undesirable side effects reported in classical texts. However, due to its strong action on blood circulation and its observed contractile action on the uterus, it should not be used by pregnant women and those who experience profuse menstruation. Toxicological studies have indicated relatively low acute toxicity at typical use levels. And there you have it, our first deep dive into the powerful world of traditional Chinese herbs that act as true blood and flow powerhouses. From notoginseng's hemostatic and heart-supporting prowess, to salvia's profound circulatory benefits, and carthamus's vibrant ability to revitalize blood flow, these ancient remedies continue to offer incredible insights for our modern health journeys. If you found this exploration fascinating, please give this video a thumbs up, share it with someone who needs to hear this, and leave a comment below telling me which herb you found most intriguing. Stay curious, stay well, and I'll see you in the next one, where we'll uncover more secrets of vitality and regulation.